community health works. And the reason it works so well is because of all of the connection and the trust and the contributions that everybody's made to everybody else's work. We talk in our mission and vision statement about regional integration of whole person health care. Regional, you have to bring people together, work on whole person means both the body and the mind, so we work on these things together, and it's the collaboration that makes Community Health Works work.
Community Health Works has gone on a long time now, and almost all of the cast of characters has changed, and it's still going on because it has produced so many good outcomes, and it really has become a partnership.
The thing that's always set Community Health Works apart is at the board level, because it's been able to bring people together at a very high level to work on a common regional problem, which is how to make people healthier.
We have board representation from our politicians to our healthcare individuals to our business individuals, and that has given us different perspectives as to the different needs for the communities.
One thing I have found to be very unusual about this organization, I don't know of a single person that we've invited to join this board that has said no. Because when you see results, it's a lot easier for you to belong to an organization and to support it. And we have results that we can be proud of.
In the beginning, we had an opportunity to apply for a Robert Wood Johnson grant to serve the and underinsured. The remarkable aspects of our Central Georgia community was how well all of the pieces came together. It can speak for what's good for the hospitals, what's good for public health, what's good for the health generally of the entire community.
Community Health Works allowed me the ability to serve and give to my patients the care and access that they needed when they wouldn't readily find it elsewhere. It also helped us to manage these patients' chronic problems and keep them out of the emergency room where the cost of care is extremely expensive.
A lot of our work in the past was focused on access. And we'll continue to be focused on access in the future. But to get to true health, we've got to address education, we've got to address economic development, we've got to address healthy behaviors. So to get to actual health, we've got to broaden our mission, and we've got to broaden the implementation plan on how we're going to get to health.
There's a national group called Communities Joined in Action, and Community Health Works has been one of the senior collaboratives. And they're one of the networks in the United States that has been able to continue bringing together leaders, thinking about the needs of the community, and thinking of creative and innovative ways to meet needs related to their access to health care and their health improvement.
Community Health Works is a great partner with Houston Healthcare in a number of ways. We are really focusing on prevention. If we can prevent somebody from having high blood pressure or prevent somebody from having diabetes, that's ideal. That's what we want.
The work that Community Health Works has done with the Central Georgia Cancer Coalition is another great example of its evolution and the effectiveness of that evolution.
It's a 25-county region focused on education, prevention, and screening of cancer. So we're continuing to expand our scope and to expand our abilities to reach the public.
There is indeed a connection between a healthy community and a community that is viable from an economic development standpoint. Having a healthy community truly lends itself to workforce development and economic development throughout Middle Georgia.
If you have a healthy community, it's usually a very functional community, and your quality of life increases, your economic life increases on it, and everybody is just plain happier.
Part of what we've been doing over the last couple of years is focusing on getting the community at large to put health first, basically behavior change. In the schools, whether it's making sure that the children have access to healthy lunches and making sure that they know about the fruits and vegetables that they're eating so that they might be able to build healthy habits that will follow them from kindergarten all the way through the rest of life.
Our Farm to School program started last year, And we continue to work with the Community Health Works in seeing the ways that we can improve children's diets and impact the community and their families.
Community Health Works has really helped the faith-based community share and understand what's important about health. We're trying to educate as many people as we can. It used to be we would have only fried chicken. Now we have fried and baked chicken, and I give Community Health Works credit for that.
This year's been a great year for Community Health Works with the success of the Mulberry Street Market and the International City Market. So our whole food access component is working to make sure that people have access to what they need to be healthy.
Good health really isn't hard. And here in the South, we really don't have any excuse because fresh vegetables, they're all around us. It's a mindset first. The first mindset is that you can eat healthy and it can taste good.
We're now trying to get people to be more active. We're trying to change their lifestyle to make them healthier so that in the future they won't need to have as much access to health care. Community Health Works has set up coalitions in all of the counties. We meet on a quarterly basis and we discuss different aspects of the community and how we can make the community better. And here in Crawford County, we have built a track that Community Health Works was involved to try to get people to be more active. And that walking trail, part of it came through this coalition.
In each county, it's different. Some counties have more resources than others. Some counties have a lot of ideas but just don't have the capacity. And so what we're doing is trying to meet those needs as best we can.
This coalition is a good group to make a difference in our community, and coming together is the key to that because you need people with different perspectives and everybody brings their talents and their abilities and they put it together and it turns out to be something good.
It's a great example of the whole being worth more than the sum of the parts. None of the players could be doing what they're doing by themselves and have the impact they have when we're all pulling together. And that's what Community Health Works is doing. The whole team of healthcare providers are pulling together to improve the health of our community.
Through Community Health Works, we are now on our third year having a Central Georgia Regional Health Summit. All of the participants of these coalitions have been part of the summit. And through this summit, we have learned of different things that each other community has done that has been successful for them. And each community can then bring that back to the coalition meetings and discuss whether it would be a good fit for their community.
We've designed the Health Summit to reach as many people as we can, to bring the minds together, to look for ways to make health easy.
Community Health Works is a long-term investment in bending the cost curve in healthcare. It requires a cultural change, a change in the way people approach their health, a change in the way we think about healthcare, and a change in the way we treat people. Prevention will be the key, and I think the work that we're doing in Community Health Works, though we won't see day to day the fruits of that labor, over time we'll all be very pleased with the return on investment.
The success of an organization can't just be based on the success of its life or that it gets more money or that it pays salaries. It has a mission, and that's the greatest part of Community Health Works. There are literally thousands of people's lives that have been positively affected by the work that Community Health Works does. The woman who has the mammogram, because Community Health Works has advertised the availability properly, helped the person get to the site for the mammogram, and then found cancer early and who can then be treated early, there's no way you can measure the success of that. It's a person's life, and it's that person's children's life and their family's life. So Community Health Works has touched literally thousands of citizens in Central Georgia, and that's really where the success of the organization lies, with the people who have been touched by it.